Hello all, welcome to another video of Emergency Medicine Simplified. So you all might be aware of one of the common reason for emergency room visit by a patient is a low backache or a back pain. That has been one of the commonest presentation by which a patient comes to the emergency room. There are various differential diagnoses, but while taking history, we definitely need to think about certain red flags. So I'll be just discussing what are the common red flag from the history that you need to take for a patient who is presenting to the emergency room with a back pain. So let's see the point number one. If the onset of back pain and the patient's age is less than 20 or above 55. So that is very, very important. So that's the first thing that you need to have. And second thing, it's a non-mechanical back pain. So you assume that it is not a musculoskeletal pain. It's not just a muscle spasm. So that's the next point. And if the patient has got a thoracic pain, that is again very important. It is a red flag. Then very important another history that you need to look in for, the previous history of any HIV or any immunosuppression, specifically any IV drug abuse or any other history is there you need to ask in for. Any history of fever, weight loss. Again, fever points towards an infection and weight loss point towards probable malignancy. So that's the very important questions that you need to ask in for. And you need to ask for any history of focal neurological deficits, any lower limb weakness specifically, and also for any bowel and bladder involvement. So that's the next crucial information that you need to collect from the patient. And while examining also, you need to look for any structural spinal deformity, whether there is any structural spinal deformity that you are able to elicit. And if the patient is generally unwell, he's saying that generally unwell, I'm not well since past few days, you need to keep in your mind. Don't always think that a patient presenting to emergency room is only having a spinal cord related pathology. As I told, the age above 55, you need to think about one of the common differential, well, not very common differential, but one of the deadliest differential diagnosis of an abdominal aortic aneurysm also. So that's it from me for today for the red flags for the low backache, or you can call it as red flags for back pain. Thank you.